So it's interesting that I think that the goals of an oncologist and the patient obviously largely overlap in the first one or few appointments, but we do have probably some different priorities that we want to ensure we cover. As an oncologist, what I really want to convey first is a sense of the diagnosis, the stage of the cancer, and in broad strokes, what are the realistic goals of treatment? And specifically, is this a setting that is a curative one or one in which our goal is to prolong survival, but we cannot realistically talk about treating for cure, because we would be more aggressive with treatments that have the potential for cure. We need to be more mindful of the side effects versus efficacy in a setting where that is not something that we are realistically pursuing. But of course, we want to talk in broad strokes about how big an impact we can have for a patient in terms of prolonging survival and just giving a sense of the options available. Sometimes there's a very clear sense of there's a standard way that we routinely do this, and let me outline what that generally comprises with some feedback from the patient, asking questions or clarifying that this does or doesn't work for them. Sometimes there's several options to think about, and there's really a lot of input from a patient about their goals. That's always a part of it, but particularly when there's many comparable options to consider, it can be very important to have a patient weigh in on their level of side effects that they're willing to accept or not. So I would say those are the biggest issues. There's often some unanswered questions in the beginning from my side in terms of, do we need to do more scans? Do we need to do more molecular marker tests and things? I know also, Leanne, you've viewed it from the other side, and I'm sure had your own perspective on what you were hoping to get out of that first one or two appointments in terms of what you needed to learn and how to go forward.
Yep. With my original doctor in Texas, he was not very forthcoming with information and didn't answer a lot of my questions. He was just in the here and now and just put me on my medicine. And when I first met Dr. West, you know, he was apologetic for what I was going through, but said to me, I remember in that first appointment, said, we're looking at years and years. And that's something I never got, and that gave me hope.
I think that it's often a real challenge to, you want to be realistic and you want to be hopeful. We don't want to misrepresent things. We don't want to lie by omission. But I think especially if you do have encouraging things to say, you definitely want to share that. Can you talk a little more about what was the most important thing for you to learn about? I mean, besides the broad idea of there being hope, what as a patient is the most important information for you to come away with in your first one or two appointments?
What I found was, you mentioned that the treatment I was on wasn't my only treatment. We had stuff in the future. You keep saying things on the back burner in our back pocket. And, you know, if I can hang around long enough, there'll be more to add to that back burner and back pocket.
Yeah.
And as you say, it's a long game.
What, any particular advice you have for other patients? I mean, you actually ended up seeing me as your second oncologist. Would you recommend that patients shop around, or is that realistic for many patients, do you think?
I think they should. I think, first of all, you should go to a doctor that is your specialty, the type of cancer you have. I think that's very important. I would have gone for a second opinion back in Texas, but then we moved, so you were my second opinion. So, but yeah, I definitely recommend people get more than one opinion, because doctors have different views.
Yeah, that's true. And also, you know, it's telling that you you travel a distance to see me. You must pass several oncology offices, so I know that there's different priorities for different people, but I do think it is helpful as the field gets more complex for you to at least get an occasional opinion from somebody who really focuses on that type of cancer, if at all possible, even if they aren't your day-to-day oncologist.
Yeah, definitely.